Hey guys, thank you for joining us for another Men's Bible Brief. This is Pastor Autry. If you can, join us on Wednesday mornings. The info is on the screen. If not, we got you covered right here on YouTube. Well, let's go ahead and join the brief in progress. God bless you.
Well, good morning, brothers. Welcome to Christ Community Brothers Bible Brief. It is 7 o'clock on a Wednesday morning. We got some more brothers coming in to the brief. My name is Ron Madison, and I'll be your host for this morning. I would like to thank each of you for coming out and joining us. The Bible Brief lasts about 30 minutes, give or take, on the questions and comments and robust conversation. There are a few things to go over before we get started. One, this is a safe environment. We don't judge. We do record the speaker's portion of the Brothers Bible Brief and post it on YouTube afterwards, and the content is evergreen. So if you miss it, or if it's so good that you want to share it and you know that other people will benefit from it, share the link with them after. After each Bible Brief, you will have an opportunity to make comments, ask questions. We ask that you use the raise your hand feature in the chat to be recognized. And if you don't know where that is, if you look on the bottom of your computer screen or on the bottom of your phone, you'll see the reactions button with the little smiley face. If you click that, you'll see the raise your hand feature. We ask you to use that to be recognized. We ask that you limit your comments to no more than 2 minutes, as we want to give as many brothers as possible a chance to make comments and chop it up. If you have to leave early, it's never a problem. If you would like to let us know, just say goodbye in the chat or let us know that you're leaving. And also, if you want to share links, books, resources, or share extended comments that have resonated with you from the speaker, please utilize the chat to engage and share those resources. At this time, we ask you to mute yourself. Make sure you are muted. Maintain a level of respect, anonymity, and Zoom etiquette. The Wednesday Hump Day food for thought comes from Kobe Bryant. Pastor will like this. Comes from Kobe Bryant, Lakers great. He said, "It's only one thing you can control. You are responsible for how people remember you or don't. So don't take it lightly." Our speaker for the day is Dr. Edwards, special guest who's come to us to talk to us about men's health issue and colon cancer. Dr. Edwards, thank you so much for being with us. If you can unmute yourself, and hopefully you can share your screen for those things you have for us.
All right. Good morning, my brothers, and to all of you and to the pastor. It's when I started to put this together, I was thinking about it, it's to make sure that I don't get crossed over and twisted and start preaching. So I got my PowerPoint so I can stay focused on where we are. But first of all, I'm glad to be here with you guys this morning. I learned a long time ago that when people invite you into their domain, they don't necessarily have to pick you to be invited to. And I count it a blessing to have this opportunity to be with my brothers. And hopefully we will be able to share with you some of the things that we can do for ourselves, some of the things that we'll have to depend on each other to get there and to become very healthy men so we can carry out our duties as children of God. So I do thank you for that. I found out years ago also that I didn't get saved to take sides. I got saved to take over. So when I get a chance to share with my brothers what I've learned in my 42 years of this medical field, I never missed the opportunity to do so. And so I was asked to come on and share with you a little bit about colon cancer, and we'll talk about it. I'll keep it rather simple. I will not get into the big terms and so forth. We'll keep it rather simple and and clean and make sure that we can actually glean from this and make sure that we can use some of the information that we need to. Here in America, we don't really have a great health system. We got a lot of fancy things that go on, but we don't really take care of patients in the way that we should. And so we're going to share that with you today. So before we start, I'd like to have a word of prayer, if that's all right with you guys. Is that okay? All right.
Yes,
Father,
sir.
we thank you for this time together. We thank you for the brothers who've come together, and we seek your face, Father, for what we're trying to accomplish. We know that you are the great healer, and we depend on you for all that we will accomplish today. And we pray now that if there's any sick among us, that they will be healed by the power of God. And I thank you now for giving me the word and the gumption to share with these brothers. Now, sanctified and justified, that we will be blessed today because of what you've done in our lives. In Jesus' name we pray. Amen. All right, I want to talk with you about colon cancer. So I was asked a few months ago to do this, put this together, and I'm board certified in family and sports medicine. I've worked emergency medicine the last 22 years. And so I have a pretty good knowledge of what really goes on. You see this a lot in the ER, people who are not even aware that they have it. It is a very sneaky disease. When it shows up, it can be very attacking to us. And so what I want you to remember is there are things I want you to know that we'll have to do for ourselves. You can't expect somebody else to do that. And so it's been once said that food is your medicine and medicine is your food. And the body has the innate ability to heal itself if you give it what it needs. Most people are not aware that 60% of the immune system that you have comes from the GI tract. So if you take care of it, you'll have a good chance of living a life that is not interrupted by illnesses. So the GI tract is a very serious aspect of our 11 systems that we have. And then we found out, and you all know very well, that the body is the temple of the living God. So where he lives, we want to make sure that he has a comfortable place to stay, and he can live and guide us with ease. So I just want you to keep in mind, and you'll be able to share this a little bit later. But what we eat, that's who we are. My incentive for this is in 1970, there was a 53-year-old Black male who passed away at colon cancer. He had metastases. He smoked 1 to 2 cigarettes per day. He was a school teacher. He was a farmer. And all of a sudden, he started having unexplained weight loss and blood in his stool, nausea and vomiting, abdominal pain. He was diagnosed by his doctor as having a stomach ulcer, and they treated that with goat's milk and antacids. After some while, over 6-8 months, found out that this patient had colon cancer. Not only did he have colon cancer, it had metastasized. It happened to be my dad at age 53 in 1970. And so after I saw what had taken place, I was energized to go into the medical field, which I already was going to do, and to make sure that this doesn't happen to another individual. And so I wanted to also, let you know that I had an incentive to this was close and dear to my heart as well. One of the things I do want you all to recognize is that this is a condition that can be very asymptomatic and painless. And so there are people who believe that since I don't have pain and I don't have any symptoms, that there isn't anything going on. That is not the fact. And so we have to get engaged and participate in the screening, the early screening, which, a lot of, men don't like, of, the rectal exam and the colonoscopies and so forth. So at 70, I have mine scheduled for next week. I had one 5 years ago. I don't like doctors either, just like you all do. But it's apropos that we do necessary things that's good for us. And so early screening can play a major role in the diagnosis and of these curable lesions that you find that you have that you don't know about. And so I believe we can continue to, if we get involved and take care of ourselves, I think we can be better servants for God. Let's look at some of the signs and symptoms. The most common sign and symptom that you'll have is abdominal pain. You don't have any reason to have abdominal pain. You've eaten the same type of foods for years. So the most common presenting symptom would be abdominal pain. Normally your blood, or your doctor will draw some blood if he thinks that there's an issue, and you'll find out that you may have some iron deficiency. There may be some rectal bleeding. There may be changes in bowel habits. Always notice that if there's a change in your habits, and then you could have abdominal mass as well as diarrhea. Let's look at this. This is just a glimpse of the GI tract. As we look up at the top there, you can see the oral cavity. That's what we eat, and we're watching the football game, and we're eating barbecue, and we got some pork chops, and so this is the start of what could be good for us, and also what could not be so good for us. And that is, you will see up at the top where it says oral cavity. Obviously, we eat there and we chew and we swallow. It comes to the esophagus, down to the stomach through the duodenum. And then all of the reactions and chemistry starts to really take place. It also starts in the mouth because we have saliva, which has enzymes to help break down food. So what you put in is probably what you're going to get out. So you see here, the big thing that I want you to just recognize out of this slide is the liver, the pancreas. You can see that you should see it on the right side, pancreatic duct. Those are telltale. If they start to becoming abnormal, you're starting to get high normal results. I would really start to look at the screening process in a very vivid way. So the food, if you look at the green portion there where it says transverse colon, ascending colon, descending colon, then you look at the ileum, the small intestines there. Okay, if I take that and just rolled it all the way out like it was a water hose, that's about 20 feet of material there. So it's a lot of reactions and a lot of chemistry that takes place in those in this area. But where you see, go down to the bottom there, you'll see a rectum where it says rectum and anus. They are critical, okay? And so you want to make sure that you get your annual screenings and make sure that things are, on the up and up, because they can get away rather quickly. Physical exam. What will a doctor do? What will you go into the doctor for a physical exam for, other than your annual routine? And that will be, doctor, just not feeling good. Then I don't feel like I used to. Look like I'm, losing weight, and I haven't changed my eating habits. My abdomen is tender, and of course, there's some bright red blood. I hadn't seen that before, and Just my right side is a little bit tender of my abdomen, which could be your liver, which you may see there, hepatomegaly. And then sometimes I'd have some swelling around my stomach. I'm just not real sure what's going on. So in those physical exams, those are the kind of things that you want to hear from him as to, or her, you know, what could this be, and do I really need to get aggressive with my with my health care. Let's look at some of the differential diagnoses that can be that we can talk about. AV malformation could be other than cancer, carcinoid, the neuroendocrine tumors, and of course rare tumors in the GI tract. We can look at ischemic bowel disease that I see often in the emergency room when they come in with pain that I've never had before. This is unbearable, and the bowel has actually gone into where there's not enough circulation into major parts, and we call that ischemia. Small cell intestinal carcinoma, GI lymphomas, Crohn's disease, which you well aware of, ulcerative colitis, and diverticulosis, as well as diverticulitis, are some of the differential diagnoses that doctor has to keep in mind that we need to rule out to make sure that we're not missing anything in this patient. Testing is blood work. You may have a CT scan. You may have an MRI with or without contrast. A contrast ultrasound. The PET scan which is you usually get those at the larger institutions. CT scan with oral contrast, and then of course colonoscopy. Currently, I am opening a clinic at Ann Arbor and Marsalis, an urgent care clinic where I also purchased a CT scanner, ultrasound, and so in that community, a lot of these people have really never really been tested as they should. And at 71, I'm going back into practice. I believe God has led me to do this, and I'm going to do it. I believe also that the greatest form of pleasing God is obedience. Sometimes it's not what we think we ought to have, but that's not important. Obedience is the clearest form of faith. So I'm walking by faith and not by age or not by sight. Let's look at the risk factors: smoking, family history of cancer, particularly colon cancer, hereditary polyposis, attenuated familial polyposis, as well as cancers of the separate segments of the colon. So you can have one section of the colon can have one type of cancer, and then another section can have another type of cancer. So this is a really, it can be really tricky. And, I like quiet people, and some people like people who talk a lot. Okay. I'd rather, I'm a little scared of quiet people because you don't know what they're really up to. So the colon is kind of like that. You don't know what it's up to. So you have to stay on top of it and make sure that you do what is correct. Let's look at some of the screening, and I mentioned that just quickly. The screening and prevention is colonoscopy, barium minimus with double contrast, flexible sigmoidoscopies, CT scan, annual guag, fecal immunochemical test, and as well as stool DNA. And that is becoming very important. DNA in a quiet colon can give you a lot of information. So your doctor, you can use this PowerPoint presentation as you wish. And if your doctor is not on board, with what you think and what we're talking about today, and you'll see why in just a minute. I think, to sit down and have a personal conversation that, hey, had this doctor come to our men's conference, our men's fellowship, and he, hear some of the things he recommended, so forth and so on. And I don't try to tell people what to do, but what I do know is that my 53-year-old dad, had he been scoped, he probably would have still been living. So while I have, these big terms that I use, and I have all these big machines, I do believe in strong doctor-patient relationships. And a doctor that won't sit down and talk with you, if he doesn't have the time to sit down and talk to you, we all have the same amount of time every day, 24 hours, okay? So you wanna build strong relationships with your doctor so you can feel comfortable enough to ask them questions that they really should be able to answer. And if he can't do it on, the hours, to set up a time with you so they can sit down and talk with you about what possibly could be, going on. Let's look at race and colon cancer. Since 1999, well, let me say this before I go into this particular slide. We have, as African-American people who were brought to this country and enslaved. We were not enslaved people. We were brought to this country and we were enslaved. And we have never had first-class health care in this country at any point in time. Got a little bit better after the Civil War. As you well remember that, we had medical schools, in the Reconstruction period, we had, hospitals. Currently, there are 5,500 hospitals in America. There are only 3 owned by Blacks. Here in Dallas, we have 41 hospitals in Dallas County. There's only 2 hospitals south of the Trinity. 39 of them are on the north side of the Trinity, okay? So you have 1 million people with 2 hospitals, and you got another side of the city with 1 million people, and you have 39 hospitals. So there's nothing wrong with you. So there's nothing wrong with your people. There's nothing wrong. You give me the resources where I can be screened, where I can be tested, where I have the doctors, to examine me, then we can talk about equity in the healthcare system. I have a book that will be coming out in the next 8 months or so. The title of it is the 3 colors of the American health system: black, white, and green. And now we've moved from the Hippocratic Oath to more, show me your Blue Cross and Blue Shield, your Aetna card, your Humana card first, and we'll start talking about some real health care. But if you don't have one of those, you may be headed to Parkland or one of the public hospitals where you are treated with 4th-year medical students, interns, residents, and fellows. So you don't get the very, very best of the training and those who have best access to healthcare, rendering healthcare. So I want you to not take this personal. It's just a fact. We've had this differential and the disparities for quite some time. So since 1989, colorectal cancer has been much higher in Blacks than whites, 24% higher in Black men, 19% in Black women. The mortality rate is 47% higher in Blacks and 34% higher in Black women than they are white men and white women. And that's nothing, if you have the access to the care, and when you have 39 hospitals on one side of town and 2 on the other, but you got the same population on each side, that's just a matter of integrity so far as I'm concerned. And as long as I practice, I'm going to give my patients the very best. And if you don't like what I do, I will escort you down the street to another doctor who you believe is better. So I make no qualms about my stance in this profession. And so I urge you all to have the same type of relationship and be bold about who you are. You're a child of God. You have a right to live a life that is not encumbered by sickness and disease. My grandparents used to say you just go out and sit on the garret and rock and tell everybody bye and get on out of town. You don't have to die of disease or heart attack or stroke. You can walk away and yield up the ghost and go to be with our Father. Between 2007 and 2016, the death declined faster in Blacks and colorectal cancer. Now, anybody may want to give me a shot at that, but I'll just let you know that the Affordable Care Act has really been a blessing for us. I had a chance to meet with President Obama, and we talked about it. In fact, in my urgent care clinic that I'll be open in a few minutes in the next few days, I took a picture with him as well. I asked him, could he beat Michael Jordan in basketball? He said, I think I can. He was a nice guy, but the fact of it is that the Affordable Care Act brought some equity to where people could go and be tested prior to having symptoms. And that's why you see this number between 2007 and 2016. And this is the first time also that the American Medical Association ever voted for any legislation that would improve Black outcomes. But that was because they were going to make so much money from the pharmaceutical industries. They have, 70% of all of the doctors in America are white. So this was going to be a paycheck for them. So indirectly, it wasn't anything that they did because they loved us. And I'm not saying that they don't, but I'm saying that there was a policy that was put in place that allowed us to be checked earlier, and this colorectal cancer has dropped. Worldwide, there's 935,173 deaths in 2020, about almost 10% of the overall mortality rate. And then it's the second highest among cancer deaths. So I want to just, as I get ready to close here, is obesity. It's everywhere you go, it's on the corner, you got either McDonald's or you got a Burger King or you have, Popeye's chicken, or you got, so we have fast foods that are high in saturated fats, high in sugar. Every time you drink a 12-ounce bottle, a can of soda, you have 8 to 12 teaspoons of sugar. There are people drink 2 to 3 of these a day. You won't be able to maintain a health system, health status with that kind of intake. And then they'll eat a barbecue sandwich on the way home. So you have to be real careful, and you have to be purposeful about your health. You have to know that I can't eat. I played football at Kilgore Junior College and transferred to North Texas State. I was all Missouri Valley Conference there in 1970. Went to the St. Louis Cardinals in 1973. And I'm about the same size now. I mean, I've gotten up to 195, and man, that ain't gonna work for me. So 183, 180, I stay right in between there. I make sure that I do what I need to do. I don't smoke. I don't drink. And I'm not saying, hey guys, if that's what you want to do, that's not what I'm talking about. I'm not casting stone on anybody, but I do want you to know that there are some things that you can do, modify, that will help you to live a more quality life and see your family and have fun with your family. Your body mass index is very, very important. The artificial intelligence now that we have in medicine can tell us what that actually means for us. And so rest and relaxation, you got to sleep well. If you don't sleep good at night, get you a good mattress, invest in that, make sure that you can get your at least another 30 to 45 minutes of sleep that adds 15 years onto your life. Social determinants, access to healthcare. Can you get in to see your doctor? Is it 2 months before you can see that doctor? Environmental, do you live close to a center where, for instance, like down in Beaumont, they have a lot of oil. And so people who live close to those oil channels, there are different chemicals that are in the air. And you see that, also saw that in Michigan. The type of foods that we have in our communities, the health deserts that are created by our system. And then clean water and clean air. I don't drink any spring water. I only drink water with pH of 8.9 and higher. I think that helps to balance the gastrointestinal tract that operates from a pH of about 8. And so many of us have pHs run below 8, 7.3, 7.4, which is just a little bit too acidic. When I work at night, emergency medicine, I have water, I have fruit, and then I have nuts, the trail nuts, and that's what I eat. And so I don't eat, any major foods. I mean, from time to time they'll go out and I may eat a piece of pizza, but that's just about it. That everybody knows what I bring to work. Now that's discipline that I had to develop. Okay, I haven't always been that, but I'm continuing. I ask God to give me the strength to be able to do what I can do, be healthy, and I can do the work that He sent me out to do. I'm very cognizant of my relationship with God. Not everybody, but this is a Christian group, so I can say that. Okay, everybody won't receive it in the same way, but I try my best to be in line with what He asked me to do, what I know in Scripture, and then ask Him to reveal to me what is it in my life that He wants to express, and if I can do anything about it, I'll do that. And so health is actually one of them. Guys, I do thank you for giving me this chance, this opportunity to speak with you. If there are any questions, I'll be more than happy to try to address them.